Hello everyone, welcome back to another podcast. I am Dr. Ankita, MSL for Glenmark Oncology looking after the East Zone. Today we're going to talk about the myths surrounding chemotherapy. Chemotherapy is something that instantly creates fear. For many patients, even hearing the word chemotherapy brings in anxiety, too many questions, and most often a lot of misconceptions. Today, we're going to separate fear from facts and help you understand what chemotherapy actually stands for in today's world. To guide us through this very important discussion, we have with us Dr. Joydeep Ghosh, Senior Consultant Medical Oncologist at Apollo Hospitals, Kolkata. Thank you so much, sir, for joining us today.
Thank you.
So, sir, starting with something very basic. Chemotherapy is the most commonly used cancer treatment, yet it's one of the most feared. So, sir, why do you think this reaction is so strong? Is this because the patient's perception is still shaped because of older experiences or outdated information?
I strongly feel there are a lot of other factors. Firstly, suppose we talk of surgery or radiotherapy. Since these are very short lived, whatever problems the patients face, it's for a very shorter duration. But on the other hand, chemotherapy usually lasts for 4 to 6 months or sometimes even longer than that. So, since the patients have to undergo side effects, if there are any, with chemotherapy for much longer duration, that is one of the reason why chemotherapy takes the maximum blame for being the most problematic treatment. And secondly, you have rightly mentioned that the older generation chemotherapy, they definitely have a much higher side effect profile, much worse side effect profile, and they used to cause a lot of side effects, and that obviously many patients suffered the side effects from those chemotherapy regimens. So that has led to a sort of a belief in the society that chemotherapy is very difficult to handle. So these are the reasons, I would say.
Oh, that's very informative, sir. So, when people think of chemotherapy, a common thing that comes on their mind is about the side effects. So, I just wanted to know from you how accurate is this in today's world, and has chemotherapy become more tolerable in comparison to the earlier times?
Right. So, definitely, you are right that chemotherapy does have side effects, and at the same time, fortunately, the side effects have reduced with time. Why it has reduced? Because initially, in the past, the regimens which we used to use for most of the cancers, they were sometimes very toxic regimens. They had multiple chemotherapy agents in these regimens, and also the doses were quite high.
Mhm.
With every passing decade, we are having more and more research, clinical research directed towards improving the quality of life and at the same time achieving the same level of efficacy. So, in today's world, we do have regimens which are much better tolerated than it was 20, 30 years ago. So, definitely the tolerability has improved. I won't say the side effects have become zero, that will be wrong, but definitely the side effects have become manageable.
Okay.
And at the same time, nowadays the clinical research is also focused on something called health related quality of life, which means that what has been the quality of life journey of the patient when the patient is getting the chemotherapy or immunotherapy or targeted therapy or whatever it is. So in these quality of life related measures, it has been seen that most of the recent regimens, they have a very good quality of life being maintained throughout the treatment duration. So that directly tells us that the patients are feeling better. At least they are not having significant deterioration of their feel good factor when they are on chemotherapy. So quality of life results as per latest clinical trials confirms the fact that the adaptability or the tolerance to chemotherapy has significantly improved over time.
So, sir, that's really reassuring for the patients mainly. Another thing, sir, hair loss and vomiting. These are very common concerns.
Right.
So, sir, do they vary from patient to patient?
So, coming into each of one of these, so first taking the hair loss part. Again, hair loss is something which is more specific for the regimen rather than the patient.
Right.
Because there are regimens which affect the hair follicles, there are regimens which does not affect the hair follicles. So most of the older agents, the older regimens, they usually have a tendency to cause hair fall. But if you look at the most recent regimens or the targeted therapies, there is hardly any hair fall, even if it is hardly 10 to 20%. But becoming completely bald is something which used to happen regularly in the past, but now there are only handful of regimens like taxanes or anthracyclines, which are used in breast cancer. These are the regimens which usually cause hair loss. And with every passing year, we are having more and more research which is directed towards using better and better drugs. And these better drugs have a much lower incidence of hair loss compared to the older generation drugs. So that tells you about the hair loss part, which is improving with time, and now it is negligible. Now, coming to nausea and vomiting, again, in the prior days when we did not have good medicines for preventing nausea and vomiting, many patients used to have a very bad experience. But now we categorize the chemotherapy regimens into three types based on their potential to cause nausea and vomiting. We label them as highly emetogenic, moderately emetogenic, or low emetogenic, which means that if a chemotherapy falls in the highly emetogenic group, uh, which means that this regimen has got a 90% chance of causing severe nausea and vomiting. And we have very good drugs which are given before chemotherapy, which takes care of this excessive propensity to cause nausea and vomiting. So nowadays, in today's date, I would say hardly less than 5% of the patients are there who would actually have a clinically significant nausea and vomiting after chemotherapy, because the preventive medicines for nausea and vomiting has evolved significantly, and we have very effective medicines to prevent chemotherapy induced nausea and vomiting.
Thank you so much for this clarity, sir. I think it's a good news for the patients as well. Sir, there's a common belief among the patients that chemotherapy is damaging the entire body. How accurate is that medically? And has chemotherapy been evolved now into a more targeted kind of therapy now?
Right. You've been absolutely right when it comes to the perceived notion about chemotherapy, that chemotherapy damages the body. But my only logic against this is that if a treatment is damaging to the body rather than beneficial, then it would not have shown results in clinical trials. It would not have become guidelines. It would not have been approved by government authorities for treatment. So there is a lot of hype about this particular aspect, that it damages the body. Chemotherapy has got certain side effects which can be long term side effects. Like, for example, some patients can have neuropathy, they have tingling, numbness, or some weakness of the muscles of the hands and feet, prolonged usage. There can be certain cardiac abnormalities. There can be some microvascular abnormalities in the form of increased chance of cardiac arrest and all those things. But you have to understand that it is not just chemotherapy. There are many treatments, surgical, radiation, also non-cancer treatments, which can have long-term effects. So giving the tag to only chemotherapy about damaging the body is incorrect. It is more, I would say, it's more of an exaggeration of the side effects that patients feel rather than the actual fact. So if say, for example, chemotherapy has got a 1% chance of causing a particular problem in the long term, it probably has a 10% chance of curing the cancer more compared to not giving chemotherapy. So that 10% benefit is not highlighted, but the 1% negative side is always highlighted.
Absolutely,
So
sir.
that is the problem of our society. We tend to highlight the negative part, but we unfortunately tend to forget the benefits that this particular regimen is giving you.
Thank you so much for clearing the facts here. Next, let's talk about fear versus delay. So, because many patients are afraid of the side effects, or maybe something they've heard from their friends or their family, many patients delay chemotherapy. How risky can that hesitation be?
Yeah. So when you are delaying the chemotherapy based on the fact that you are afraid of the side
Mhm.
effects, you are actually harming yourself more
Right.
than preventing the harm. Why? First, so when a person is scared of chemotherapy, what is the source of information? He or she must have heard it from somebody, or some family member must have gone through
Right.
chemotherapy who has had a bad taste. So in this process, what we are missing out with, or rather what is not propagated in the society, is the benefits that chemotherapy has in treating the cancer.
Mhm.
You have come to the doctor for getting yourself treated. Now if you do not take the steps which are in the direction of your treatment, you are basically allowing your cancer cells to grow. Now, quite unfortunately, there are many people who fears the treatment more than the cancer.
Right.
Just understand that the cause of death due to treatment is negligible, less than 1%, versus the cause of death due to cancer progressing, which is nearly 100%. So which are you going to fear more? Something which causes 100% death, or something which causes less than 1% death? So shift your fear to something which is actually more dangerous than something which appears to be dangerous, but it is not exactly the fact. So, keeping this in mind, when you are delaying the chemotherapy in both the settings, I'll talk of the early stage situation as well as the advanced stage situation. So, in an early stage, say for example, I have breast cancer, and I have undergone surgery, and now I need chemotherapy. So, what is the intent of chemotherapy here?
Mhm.
To kill the microscopic cancer cells.
Mhm.
Now, say, to make people understand, suppose after 3 weeks of surgery, there are, say, 100 cancer cells roaming inside the blood. So, if I start chemotherapy at 3 weeks, my chemotherapy will have a target of killing 100 cells.
Okay.
But if I delay the chemotherapy to 2 months or 3 months, I am allowing these 100 cells to become 200
Mm.
or 400.
Mm.
Now, at that point, if I am giving chemotherapy, the target cells that the chemo has to kill is much higher than what it would have been at 3 years. So, you are unnecessarily increasing your cancer burden, and you are putting more difficulty on the chemotherapy to cure you. So the chance of cure significantly reduces. There are many clinical studies which have shown that delaying chemotherapy after surgery by every week can reduce your chance of getting cured. So
Okay.
this is in the curative setting. Now coming to the advanced setting, where we are giving chemotherapy not to cure the patient but to control the disease. So if you are delaying the treatment, again you are allowing your cancer cells to grow, because your cancer cell does not have the ear or does not have the mind to understand that you are fearful about chemotherapy, so I will not grow.
Right.
They will anyways keep on growing. So, and as we talk, they are growing inside your body if
Mhm.
you are having cancer. So to put a stop in their growth process, if you are a patient who has an indication of starting chemotherapy, you should do it at the earliest with the advice of your oncologist, rather than delaying it for something, for some fear which has been created in the society, and it is more blown out of proportion than what it should be, or rather
Absolutely.
the benefits of chemotherapy should have got propagated, but unfortunately that did not happen. So stay away from the fear. We are here to help you with the fear. We are here to help you with the side effect, tide over
Absolutely.
the side effects, and go ahead with the treatment, because chemotherapy has shown survival benefit in many situations.
That's really insightful, sir. And I think this is the kind of information our viewers must be looking forward to. Sir, if you had to address one common myth that creates the most fear or harm in people's mind, what would it be?
So I would say the myth that chemotherapy causes more harm
Mhm.
than benefits. This is the biggest myth that I want people to stay away from,
Mhm.
because we all know that negative news spreads much faster than positive news.
Very true.
And here the negative news is that chemotherapy has got certain side
Yes.
effects, but the positive news is that chemotherapy has shown survival advantage and improved survival in many cancer situations. So we should spread the positive news equally fast as much as the negative news. So this myth should be should not exist, that chemotherapy causes more harm than benefit.
Thank you, sir. Lastly, one last question from my side. So, for someone being anxious before starting chemotherapy, what would your advice be for them?
Firstly, stay away from information which is not genuine.
Right.
I am a doctor, I can start writing or I can start making videos about how to do cooking or how to fly a plane. So you understand that how ingenuine that information would be, because I am not somebody who's expert in that.
Mhm.
So there are many information websites which are there. You have the American Society of Clinical Oncology, you have DCGI websites, you have American Cancer Society, also the websites of NHS and NICE guidelines, which gives you a very nice idea about the expected side effects of
Mhm.
chemotherapy as well as the benefits. So always refer to these genuine sites when you have any questions or queries regarding side effects of chemotherapy, rather than hearsay from your neighbor or some friend, because that information might not always be genuine and you might be deprived of a very important treatment in your life. And secondly, you have the option of using AI tools nowadays, because AI has been of significant help in today's oncology care. So you can download any one of the AI apps and you can ask simple prompts like, I am a patient of this cancer and I have been given this particular chemotherapy regimen. What are the side effects that I can
Mhm.
expect? So you will get a very good, genuine scientific answer. So take help of these tools and stay optimally aware of what is the exact fact, rather than depending on some hearsay or some friend's version or some neighbor's version of what is the
Absolutely.
chemotherapy side effect.
Thank you, sir. That's a lot of clarity. And also,
Thank
thank you
you.
for such an insightful discussion today. I think conversations like this are incredibly important because the more we understand, the less we fear. So, again, thank you everyone for joining us today. We're looking forward to another podcast like this very soon.